What I'm doing now is I'm looking at patients who have had significant or mild head injuries, perhaps. They're all work-related uh, patients that come through the compensation board. As mentioned earlier, we have a database of about 5,000 patients that have really quite a few hundred data entry points. And so we've been able to really look at what happens to these people. Um, and, concussion is a very interesting field in many ways. We kind of sometimes shrug our shoulders and say, well, there's not really much we can do, but we have to really study it a bit better. And, following head injury, complaints of headache, for example, neuropsychologic, neurocognitive, and dizziness are the three most common complaints that we actually see. And again, it can be quite devastating. And so we've actually found really quite a lot of good data in terms of what the organic causes can be. We've also identified that there are many other causes that can, if you like, promote certain problems and can somaticize issues. And I think that's been a game changer for us in many ways. Because, like everything else, we do work in a multidisciplinary team. We look at the patient's holistic fashion. And I'm not to say that we can actually get everyone better, but I think we can make significant improvements from the data that we've looked at. And what we were specifically looking at recently was looking at post-traumatic positional vertigo. Oftentimes, this is called crystalline disease, where you have crystals floating around inside the inner ear. And this has given us probably the world's largest series in terms of looking at what percentage of patients may have this history for the condition, but objectively, what do we find? And then how can we treat it? And again, looking at all the associations from different types of head injuries to skull fractures to so on and so forth. So to me, that's been kind of interesting looking at this group of patients.